Welcome to ACR On Air, the official podcast of the American College of Rheumatology, where we have engaging conversations with leading rheumatology professionals on topics such as the latest research on rheumatic diseases, solutions for addressing practice management issues, legislative policies impacting patient care, and more. Here's your host.
When I began my residency a little over 10 years ago, I was working 80-hour weeks and really struggled, especially during my interim year. I'm pretty sure that I had symptoms of what I would now describe as burnout. However, aside from one-on-one conversations with my program director and chief residents, there didn't seem to be much awareness of the mental toll that long hours, large patient loads, and challenging situations played on new physicians. Fortunately, there has been increasing recognitions that physicians, like normal people, also encounter anxiety, depression, substance abuse, and, burnout. To address these factors, hospitals and training programs set up resiliency workshops or provided yoga or meditation courses, assuming that if they toughen you up, both mentally and physically, you'd be better able to manage the day-to-day stressors of medical practice. More recently, however, there's acceptance that addressing mental health issues shouldn't just be left to the individual physicians. In fact, training programs and hospitals have a responsibility to design systems that decrease stress on their workforce. Today's episode is all about the importance of mental health for healthcare professionals. I'm joined by Hanna Zembrzuska, who's the only psychiatrist/rheumatologist that I know. She is currently a clinical assistant professor at the University of Iowa, holding appointments in the departments of internal medicine and psychiatry. Prior to joining the University of Iowa in 2016, Dr. Zembrzuska served as med-psych physician in the U.S. Army. She holds an MD for Rush Medical College and a master's degree in medical education from the University of Iowa. We discuss everything from what burnout is and strategies to prevent it or overcome it. We discuss the importance of having a sense of control within your medical practice and how to establish boundaries. We talk about coaching and support groups for physicians, as well as tips and tricks to maintain your mental health during busy clinic days. We address how depression and anxiety can actually cause physical pain in patients with rheumatic disease. Hopefully, this episode will help you help yourself, as well as give you the courage to improve your work setting. I hope you enjoy it.
Hanna, welcome to the show.
Thank you. I'm so excited to be here.
So you have a really interesting background. Can you tell me a little bit about how you ended up where you are?
Sure. Well, I went to med school at Rush Medical College and I signed up for the Army Health Professions Scholarship Program and ended up doing my residency at Walter Reed Army Medical Center in DC. And I did a combined internal medicine psychiatry residency. And I served as a med psych doctor in the Army until 2016. When I came to Iowa, my husband, Zach, is from Dubuque, Iowa. So we wanted to settle by family. And I've been at Iowa since then. Initially, I was a med psych doctor, and I decided kind of later in life to jump back into GME training and went into rheumatology fellowship in 2018.
Oh my goodness. Why did you decide to do that? What was it about rheumatology that sparked your interest?
Well, I just always found it very fascinating. It's kind of like being a detective. The patients are a big mystery. And I felt that there was a lot of mental health in rheumatology, patients struggling with chronic disease, anxiety, depression, insomnia, pain, disability. And I felt that my background could be very useful. And now I've been back as staff since 2020 here. And I feel that I made a really great decision and I love being a rheumatologist.
Awesome. So it's interesting. I remember when I was sort of thinking about doing rheumatology that I was reading some surveys that say rheumatologists are among the happiest specialists, right?
Yes.
But now it's 2022, and I saw a recent Medscape survey that said, actually, we have one of the highest burnout rates among like 25 different specialties that were included. Can you try to make sense of that? Like, what is burnout, and why do you think this high rate of burnout is being seen among rheumatologists?
Yeah, yeah. I can only speak from my experience and, what I've observed from talking with other rheumatologists. And we really get to know our patients, and many of our patients endorse a lot of symptoms, and that is a big burden to carry. And we often order a lot of lab tests and a lot of imaging, and that requires follow up and follow up tests. And now, in the age of electronic medical records, patients have a lot of accessibility to their rheumatologists. And so they can call you, maybe they can email you, they can send you my chart messages. And it can be tough not responding to that in a timely fashion and knowing when to turn off the electronic medical record. And I think there's burnout for rheumatologists because there's a lack of control. You have a lot of stuff happening. It can get overwhelming from patients, from insurance companies, from other providers, requiring your services to try to figure out this mystery patient that must have an autoimmune disease. And I think it's just a lot. I think that contributes to burnout. Even though we love our patients and want to help them, there's just a lot going on.
Yeah, I mean, I think as physicians, we sort of have this instinct to help others. And yet, we may sometimes forget that in order to help others, we actually have to take care of ourselves first, right? Like put the oxygen mask first before, putting on to others.
Exactly.
Yeah, I hear you. So how do we start thinking about addressing some of that? I mean, it sounds based on what you said that, some of it may be more institutional as to like, well, how do we decrease all the responsibilities that rheumatologists have? But I'm sure there's a part of it that may be, something that's within our control that, may help us with our mental health.
Exactly. Yeah, I want to, I never want to blame the rheumatologist, the healthcare provider, that they're doing something wrong. I want to validate everyone's experience, what they're going through, because everyone might have a different experience. Because I feel like with burnout, it's become such a hot topic, and going to a wellness session or being told that you need to do yoga to de-stress doesn't fix anyone's problem. And it may actually add to your stress level because it's yet another thing that you have to do. So exactly like you were saying, it's going to take changes at the national, state, local, private practice level, hospital level. But the healthcare provider, the rheumatologist, should feel empowered to take back some control. And I think we just have to say no. At some point, you just have to turn off that electronic medical record. You have to start replying to those My Chart messages and ask maybe your nurse or medical assistant to kind of help out. That is easy to say, though, and hard to do because we are having a shortage of nurses and medical assistants and rheumatologists. So, again, something easy to say, but hard to implement. But we have to take back some control, and we have to set priorities. And not everything needs to be done today because I don't know about you, I clear out my Epic inbox, and for 5 minutes, I feel very happy and satisfied with myself. I go to the bathroom, I come back, and there's like 3 more messages. And
Yes.
so it will keep going. It'll keep going, so you just have to stop.
Yeah, I hear you. It's so difficult. So, for instance, tomorrow is Wednesday. Wednesday is my full clinic day. I hardly have time to answer emails like in between patients or when I'm eating lunch. So I get to the end of the day, it's 5 o'clock, and my inbox has, 50 different messages. Half of them, maybe advertisements, but, the other half maybe messages from patients. They need refills, they need labs. Did you, get the result of the MRI? And I struggle, like, do I stay an hour later and answer those messages or do I go home to my family and, maybe try to get some exercise or something? It's a big struggle because, if I don't answer that, then those 50 messages add up to the 100 other messages I get on Thursday. So how do we set boundaries? Is that something that we should speak with our practice and say, hey, I'll stop answering emails at 5 o'clock. If there's anything urgent, you should page me? Or how do you think we should negotiate those boundaries?
Yeah, I think definitely that is a good negotiation point. I know that in certain practices, they do bill for My Chart messages. So it goes to the patient's insurance. So it is, it's obviously not going to be billed like an appointment, but you will, maybe 5-10 minutes of your time spent answering that question. And that probably does have a tendency to kind of decrease the amount of messages. I also, if a patient is sending me a message and I feel like they need to be seen for an appointment, either with me or maybe the physician assistant nurse practitioner sooner, then I will just quickly, go from that conversation to an appointment rather than going back and forth with the patient. I personally try not to log in to Epic after hours or on the weekends. And I leave right at 5. I have a 20-month-old and a 4-year-old, and
Okay.
I just kind of rush home to help my spouse. So that makes it easy. But I remember when I did not have small children, I would stay there and answer those messages. But now I don't even think about it. I just make that as a priority.
Yeah. And something you mentioned, I think stuck with me is the sense of control.
Yes.
Right. So what does control have to do with your mental health? Can you talk more about that?
Yeah. I think a normal state is anxiety and a sense of feeling overwhelmed. And when people struggle with anxiety, they try to decrease it by controlling things. It just helps to kind of narrow your scope and kind of put things together.
One of the things I remember like reading, looking at this quadrant that says, I don't remember if it was like happiness or something, but on one quadrant it says like, control or not in control. And in order to be happy, like you need to feel like you're in control and you're doing things that are sort of useful, right? Things that are not under your control feels like somebody's ordering you to do things. And that certainly doesn't feel good, even though if, it may be the thing that we want to do, but if somebody's telling you to do it, I sort of have this inherent rejection to whatever it is that somebody tells me to do.
Yes.
I don't know where that comes from.
Yeah, I think there's like a rebel tendency, like you don't want anyone to kind of boss you around. And
Yeah.
some individuals can't even boss themselves around in a way because you want to just resist with whatever. Yes, I think, when the system is kind of overwhelming and there's a lot of things that are out of your control, then being able to control when you can exercise, going to the bathroom, how many glasses of water do you drink, how many messages you answer. I think that just helps kind of make you feel less overwhelmed.
Yeah. And how do you think, over the last couple of years, we're doing many more things virtually, right? That it's the virtual visits, it's the Zoom meetings, it's more emails because we're not seeing people, in the hallways as much. Do you think that has also taken an increased toll on our mental health because of, I don't know, lack of face-to-face relationships?
I do. I think there's more loneliness maybe, when you rely so much on digital, because it's not the same. If we were in person, it would be a lot different than doing this podcast via the Zencaster. But maybe if we had to be in person, this wouldn't be happening right now. So it affords a lot of opportunities, but then it's not as personable. I do feel personally that when we went into the pandemic and we stopped having in-person conferences and meetings, I felt like I saw my colleagues a lot less.
Yeah.
But then I'm part of some Facebook groups for physicians, like the Physician Moms group and the Women's Rheumatology group. And I feel like I gained that because I spent more time on those groups. And so you kind of get a larger audience and you have this community. But the other bad things about social media and being more connected digitally is that you start comparing yourself to others, and maybe you have a FOMO, fear of missing out. Like, look at these great things all these other physicians are doing, these other rheumatologists are doing, and what am I doing? I'm not at the level that they're at, and that does nothing for your mental health. So you want to
Or nothing good.
nothing good, nothing good. Yeah, you want to realize that you're doing that. It doesn't only affect, teenagers, it affects adults too
Sure.
when you start comparing yourself with others. Yeah.
Yeah, I certainly get that. I'm on Twitter and all these people I know are like, oh, I'm humbled to receive this wonderful award and my RO1 just got funded and, I'm chief medical officer of this new hot startup. And I'm like, I'm missing out. That makes me sad.
Yeah.
So yeah, I agree with you. I think social media has the potential for benefit, as you mentioned, if you encounter supportive groups that can support each other in sort of our mission in rheumatologists or women in medicine. But at the same time, there's that risk of comparison and making you feel bad about yourself. So you have to, I've heard social media is just a tool, and it sort of depends how you use it, right? You could use it for good or for bad, and you just have to be sort of cognizant and wise about it. Seems like mental health issues have become at the forefront of not just, hospitals, but sort of national guidelines, right? The recognition of the importance of prioritizing the mental health of healthcare providers. Can you tell me more about sort of what national projects have started or will start soon for doctors?
So in terms of national things that are happening, there's the Dr. Lorna Breen Foundation. Dr. Lorna Breen was an emergency room physician in New York City, and she died by suicide on April 26, 2020. There was legislation passed in her name, the Dr. Lorna Breen Healthcare Provider Protection Act, which is, doing research on initiatives that can protect the mental health care of providers. One interesting thing that is happening on July 16th, 2022, is that 988 has been designated as the new 3-digit dialing code, and it'll kind of be like 911, where you dial in 988 and it will route you to the National Suicide Prevention Lifeline. So it's not active yet, but July 16th, that will be happening. So that will be a good resource. Of course, suicidal thoughts, suicide is like the worst outcome that can happen with burnout, anxiety, depression, but it's a very real thing. And I think the good thing is that there's been a much more open conversation about this topic, because there's such a stigma with mental health and healthcare providers. And we just need to kind of shine a light on it and discuss it and provide our colleagues with any help that they might need.
Great. 988. So coming to you soon in July. That's a great resource to know. So let's talk about sort of tools and tips that we could use as physicians sort of in our day-to-day practice. Are there sort of any tools or routines that you use, either in the morning as you're getting ready to go to work, or in the middle of the workday where you have, 15 patients that you need to see? What sort of things can we do to sort of make sure our mental health stays in a healthy way?
Yeah, I think one thing that I started doing is driving to work and driving home in silence. So I used to be a big fan of music or listening to podcasts. And I had a colleague when I was younger, and I noticed that he would drive into work in pure silence. And I was kind of astounded by this. And I was like, isn't that so boring? And he had multiple young children. And he's like, oh, no. It's like the most peaceful part of my day. And I didn't understand until I had my own children, and I kind of cut down on the noise and just kind of collect my thoughts, prepare for the day in the car, and then kind of disconnect from work by driving home in silence. And so that's one thing that I do, kind of sets the day. Another thing that I think is important for people to do is movement. We are kind of chained to the desk. And so just taking time in between patients, even just to walk down the hall. And if you can incorporate, looking out the window and looking at the weather to kind of reconnect back with what's happening outside the world, or even step outside for 5 minutes. Even if you work in an urban area, you can still, maybe you don't see a lot of trees or nature or anything like that, but you can still look at the sky, at the clouds, at the sunshine, and nature does a lot to help us de-stress. So I think movement, reconnecting with nature, or maybe you have some plants. So I have my little fake plants there.
I love it.
Because I kill even a succulent. But they look very nice and naturey, So
and your brain can't tell the difference. So that's great.
Because that looks better than like a dying one. So I think the other thing is having a community. We talked about loneliness during the pandemic, is having a sense of community. So maybe taking that 5-minute walk with a colleague, or, maybe 15 minutes of your lunch could be spent having lunch with another person and intentionally not talking about work and just talking about some lighthearted topics. I think bringing that sense of community is important. So that's what I would recommend.
Great. Yeah, I've found it useful, trying to do a little bit of meditation and sort of centering myself before I see the next patient, and just sort of, making sure that I'm sort of in the present moment instead of thinking about all the 10 patients that I still haven't seen, or the 5 that I saw in the labs that I ordered. So just trying to be present, for each patient has certainly helped me. Is there any data that you know of like meditation or exercise in the role of mental health?
I certainly have used, so I know a lot of people are familiar with Headspace. I like the Calm app. I've used that for a long time. I've actually used that with patients, like when I was working as a psychiatrist, and I would just pull it up. There's a free version, there's a paid version, and they have meditations, guided meditations that are as little as like, a minute, 2 minutes, 4 minutes. And they have guided meditations for when you're in a panic, which I like for a lot of patients. So I am not savvy enough to do a meditation on my own. I do need a guide. And I find the voice of the guided meditations to be, very soothing. And I'm a good student. I do as the guided meditation tells me. So I really like that.
That's great.
So that's what I would recommend.
And you mentioned you did it in the practice. You would turn it on and you and your patient would do the meditation together?
Yeah, because I find that if I just say, hey, get this app and do it, they're likely not going to do it. But maybe if I do it with them and they see it's very easy, it's not threatening, maybe they kind of like it, they're more likely that they'll be able to do it.
That is so cool. I think that's a great idea. I've, encouraged my patients to do meditation, and they always say, "Oh, I tried it once. I just can't keep my mind quiet." I'm like, "Yeah, that's the point, right? Like, you need to see that your mind is this monkey mind that has like 1,000 thoughts going in and out at the same time, and it's just about recognizing those thoughts." Saying, okay, yeah, I'm thinking about, lunch today, or I'm thinking about, I got to pick up my kids later today. And then going back to the breath and trying to focus your attention on the breath, right? Or on whatever else it is.
Well, that's why I like the guided meditation. I like them to start out with the short ones because I feel like if you tell them it's just a minute,
Yeah.
they'll be like, okay, I can manage a minute. And then have you ever tried like a body scan or progressive muscle relaxation? Have you tried those?
Those are great. I agree. I just do the guided meditation, and I found that, I think to be very interesting, very difficult and challenging. But like I said, I think doing that, at home later in the day helps me in between patients when I sort of take that breath in, I sort of get in the moment, right? I'm in the present. I'm there, to be for my patients, and that's been useful. That's great. So, now we're talking about sort of how we manage our encounters with our patients. And you mentioned that, patients with rheumatic disease, may have some mental health concerns. But what role do we have as rheumatologists to address the mental health concerns of our patients with rheumatic diseases?
I think we have a big role. I think just acknowledging it helps a lot of our patients. So, if you do like a rapid 3 or a lot of our assessments, they'll ask a question about anxiety or depression or sleep. And most of the patients will check something on there. And I think that invites a conversation. After you've addressed everything else, it looks like you might have some difficulty with anxiety, depression, or sleep. Tell me about that. And I think patients will just appreciate having an open conversation about it. And I think it'll open your eyes to what your patient is going through. You may not necessarily want to prescribe, an SSRI or a sleep aid, but just having that open conversation, validating their concerns, letting them know that it's common for patients with rheumatic diseases to experience these kinds of emotions and struggles, I think will be helpful. And then it just helps you to send them to the appropriate resources where they can be helped. So in my practice, I do prescribe antidepressants or anti-anxiety medications. I do prescribe medications like for fibromyalgia and sleep. And I will refer patients to the addiction clinic if I feel like they could benefit from Suboxone. So I try to have open conversations with my patients because sometimes patients don't feel comfortable going to a mental health care provider, but they will be comfortable talking about it with their rheumatologist because they feel like you get it. You understand this chronic disease that impacts their life.
I think you have such an interesting background because you could provide sort of that, mental health psychiatry component with the rheumatology component all in one package. And that's so valuable. Do you know of any other physician that has the similar background as yours?
I don't. I would love to meet them.
Okay, so for any med psych slash rheumatologist out there, please contact Hanna and she'll buy you coffee.
Yes, I would love it.
Great. And for those of us that don't typically prescribe SSRIs for depression, at what point do we think about sending them to a mental health counselor versus just, saying, sort of acknowledging, yes, this is hard. Like, when should we think about referrals, or should we think about it for every patient that may have symptoms of anxiety or depression?
I think it depends on how it's affecting their life.
Oh,
If it's
okay.
having a negative effect in their life and they feel like they can't function well, at school or at work, or it's affecting their home life, there's discussions of disability, then I definitely think they need to see the next level mental health care provider. But I think you need to ask the patient's permissions before referring them, because I know when I was on the other side of it and like on consults, I was contacted for a mental health evaluation. The patient didn't even know that I was coming to evaluate them. The patients don't like that, obviously, so having an open conversation if the patient welcomes it. And some patients may welcome seeing a therapist, but maybe they're not ready or not interested in a medication. And that's okay. You meet the patient where they're at.
Yeah, that's great. So are there tips that, in addition to downloading like a meditation app, are there other tips that you provide your patients to help them address their mental health needs?
I think it's helpful to keep a journal of your symptoms. And I do try to educate patients that, if they're not doing well mentally, it may lead to increased pain perception
Mm,
and increased disability, and vice versa. Especially with sleep. I think poor sleep just amplifies everything and decreases your tolerance for any kind of distress, where it's physical distress or stress. And that's true for healthcare providers. If we're not taking care of ourselves, then it just becomes kind of like rolling a large rock up a mountain. And I just provide a lot of education and normalizing. Try to normalize things and let them know that I'm there for them and that they're not alone with whatever they're feeling. And that maybe I would recommend that they start something, but they don't feel ready, but I'm always there in case they change their mind. So I never shut the door on anything.
yeah, that's great. And I think, pain is such a big issue for most of our patients, right? And I think, when a patient with RA or lupus or fibromyalgia comes to us in pain, the instinct is to reach for that next medicine, right? It's like, well, we need to change the TNF inhibitor to something else. We have to add prednisone. And I think what you mentioned is so insightful, which is the role that for sleep or anxiety or depression may have on your pain perception, may sort of increase your sensitivity to pain so that things that normally wouldn't bother you become very bothersome. And therefore, you may not necessarily need more immunosuppression, but maybe more mental health hygiene can actually make your rheumatic disease better.
Yeah, and physical exercise. And I do try to use other modalities, like in the other podcasts we were talking about, like bracing and taping and, massage. I love arthritis compression gloves, paraffin baths, massage if you can tolerate the sensation, just various other modalities other than a medication. There's so many that can work great for a patient.
Great. And is there anything else that you feel needs to be further researched in terms of, how to improve or manage the mental health care for healthcare workers? If you had to design a study or try to fix a problem, what do you think are sort of the questions that still need to be answered?
Well, I'm very intrigued by imposter phenomenon, imposter syndrome. I think it really plagues us. Yeah. And
I
I feel like that is a
totally.
contribution to the burnout. I think there's a large contribution to burnout. And there's been a lot of studies on it, but the studies are the prevalence of it and who has it and what point. But there really hasn't been that much study on the treatments of it. How do you solve this? How do you treat it? And that's where I think we need more research.
I think we all experience it at every level in medicine, right? When even from first year of medical school is like, you look around, it's like, how did I get in? What am I doing here? And so forth. I think that's such an interesting topic. So for anybody out there interested, I think that's a possible, very fundable NIH application. Great. And, one last thing. So you mentioned that the 988 number is going to be routed to the National Suicide Prevention Line. Are there other resources that you can recommend either, for healthcare workers or for patients in regards to their mental health, or, sites where they can learn more or get resources, get hooked up with mental health counselors or psychiatrists? How do you address that with your patients?
One thing that I can talk about that I'm personally doing as a female academic faculty with young children, the American Medical Women's Association, AMWA, has a Physicians with Young Families group with professional coaching. So I've been doing it for a couple of months. So it's 2 professional coaches that lead this group, and it's other female physicians, all kinds of physicians, not just rheumatologists, that have small children. And we talk about balancing career and busy life. So I find group coaching is very helpful. I've done individual coaching, which is very helpful. I don't really point people to like national resources. I know that in rheumatology for patients, I do point them to like the Arthritis Foundation or their disease specific like national group. And I do encourage patients to listen to podcasts actually.
Oh, interesting.
I have an interest in psoriasis, psoriatic arthritis, and they have a lot of podcasts and, managing skin disease, managing, like itchy scalp and things like that. So I do point patients to that. What websites do you point patients to?
Good question. I don't. I think, as you mentioned, the Arthritis Foundation or certain foundations can be very helpful as, patient support groups. I think within my hospital, there are some resources where, for physicians to either speak with other physicians or get hooked up with mental health counselors or psychiatrists. But yeah, maybe there isn't a place where physicians can go and get resources. So maybe we should, Hanna, or maybe you should set that up.
I know, right?
Like a 988 for physicians or for healthcare providers, right? Where you have resources. I think that's maybe interesting.
I think what I see is that a lot of physicians don't seek care because of the stigma and because of the licensing difficulties.
Tell me more about that. Licensing difficulties.
Well, that if you seek care and then you apply for a medical license in certain states and they ask you, do you have a mental health diagnosis? Have you sought care? Are you on medication? Which are, very invasive questions. And you are honest, and then it causes you problems and you are investigated or something like that. So I think it really discourages physicians seeking care. And I know that one of the priorities of mental health care for providers is trying to do something about that so that we're not facing so many hurdles. But I don't think it's been fixed at this time. So these groups on Facebook, I feel like is almost kind of like the mental health care that providers sometimes get, like their community of physicians.
Yeah.
And then, of course, every workplace usually has an employee assistance program, but that's only like 4 to 6 sessions. And oftentimes people need more than that.
Yeah. I think, from what you've brought up, certainly we're responsible for some part of our mental health and making sure that we get proper sleep and we get our, anxiety and depression under control with professional, mental health counselors and medications or therapies as needed. But I think from an institutional perspective, we should think about how to place limits on hours and responsibilities and how we can delegate those tasks like responding to emails to other providers or other, assistants, or so that we can sort of spend our quality time with patients, in front of patients rather than in front of their medical records. And, I think that would, certainly help us and probably help patient care as well.
Yeah, definitely.
Great, Hanna. Well, thank you so much for your time. This has been really awesome, and I really appreciate your insights and your perspectives on this, since you have that great psychiatry and rheumatology background. Thanks again, and we look forward to chatting with you maybe at a later date and seeing what advances we have made, in improving physician health, mental health over that time.
Yeah, and imposter syndrome, the treatments for
Oh,
imposter
I
syndrome.
love it.
Yes,
Imposter
yes.
syndrome. Oh, and I have to comment that I love the idea of driving to work in silence.
Yeah.
Maybe one of those drives could be done listening to the ACR on Air podcasts. But aside from that, I think they definitely should be silent. Great, Hanna. Thank you so much. Have a great day.
You too. Thank you.
Thank you all for listening, downloading, and subscribing to ACR On Air.
Be sure to follow us on Facebook and Twitter at ACR Room.
Please take care of your mental health.
And as always, stay healthy.
Thank you all for listening, downloading, and subscribing to ACR On Air. Be sure to follow us on Facebook and Twitter at ACR Room for updates that we are sure you will not want to miss. And now that the show is over, why not take a walk around the block? Go for a bike ride. Go for a swim. And as always, please stay healthy.